Mr. Speaker, I would move to suspend the rules and pass S-252 as amended.
The clerk reports the title of the bill.
Senate 252, an act to reduce preterm labor and delivery and the risk of pregnancy-related deaths and complications due to pregnancy, and to reduce infant mortality caused by prematurity.
Pursuant to the rule, the gentleman from Michigan, Mr. Upton, and the gentlewoman from California, Ms. Capps, will each control 20 minutes. The chair recognizes the gentleman from Michigan.
Mr. Speaker, I would ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection.
And, Mr. Speaker, I would yield myself such time as I may consume.
The gentleman is recognized for such time as he may consume.
Mr. Speaker, S-252, known as the Preemie Reauthorization Act, is designed to strengthen health care for children, especially vulnerable children. Not only does this bill reauthorize the Preemie Act, but it also includes the authorization of the National Pediatric Research Network and the reauthorization of the CHIMP Act. The original Preemie Act that I sponsored and was signed into law back in 2006 in December brought much needed attention to the problems related to preterm birth. Since its enactment, we have made a lot of progress, but we can and we still must do better. According to the CDC, an estimated 500,000 babies are born premature every year in the United States. That's about 1 in 8. This legislation will continue and strengthen the ongoing effort to track, prevent, and treat prematurity, ensuring that every child has a healthy start and a better chance at a healthy and productive future. In addition to addressing premature births, this legislation also seeks to help children and their families with unmet health needs. The National Pediatric Research Network brings us a step closer to providing more help to children with rare pediatric and genetic diseases. This effort is going to help families like the Kennedys in my district in Mattawan, Michigan. Eric and Sarah Kennedy have 2 wonderful little daughters, Brooke and Brielle. Brielle is here in this picture, who have a rare spinal disease called spinal muscular atrophy. These 2 little angels, who are affectionately known, at least in my family, as Sleeping Beauty and Cinderella, are 2 little warriors in the effort to boost research for rare diseases and serve as an inspiration for every one of us. The sad reality is that it is often difficult to conduct research into the rare diseases due to the small number of kids with that disease. But today, with this bill, we're working to change that and provide families with greater hope for a cure or advances in treatment. This bill will help establish pediatric research networks and consortia that are effective in overcoming gaps in research. Networks and consortia that will be comprised of leading institutions that act as partners to consolidate and coordinate research efforts. And as this multi-year effort is finally nearing the finish line, yes it is, we say to the Kennedys and so many other families across the country with a similar circumstance, you are not alone in this fight. Lastly, this package includes reauthorization of the CHIMP Act of 2000 that helped establish the sanctuary system for chimpanzees that were retired from research. This bill reauthorizes the program at the current spending level for NIH's care of chimpanzees and reduces it through the next 5 years. It also is going to require the GAO to study how the NIH cares for the chimps and ask the GAO to identify how we can further save taxpayer money. I want to particularly commend Mrs. Eshoo, Mr. Lance, Ms. Capps, who has time here tonight, Ms. McMorris-Rogers, and in the Senate, certainly Chairman Harkin and Ranking Member Alexander for their wonderful efforts on this legislative package. Working together, yes, we are making a difference in the lives of so many. So I would urge my colleagues to join me in support of this legislation, and I reserve the balance of my time.
The gentleman from Michigan reserves. The gentlewoman from California is recognized.
Mr. Speaker, I yield myself such time as I may consume.
The gentlelady is recognized for much time as she may consume.
I rise in strong support of Senate Bill 252 as amended. As amended, this bipartisan legislation would address critical health care issues through the authorization or reauthorization of 3 different programs. Title I of the legislation reauthorizes the Prematurity Research Expansion and Education for Mothers Who Deliver Infants Early Act, better known as the Preemie Act. The Preemie Act was initially enacted in 2006 in response to an alarming rise in the number of premature deaths. Premature deaths, those that occur prior to 37 weeks of pregnancy, are the leading cause of newborn deaths and long-term neurological disabilities in children. Since 2006, efforts across the Department of Health and Human Services have contributed to 6 straight years of decline in the preterm birth rate. There's no question we've made progress in addressing preterm births in this country, yet 1 in 8 babies is still born premature, and prevention remains a challenge due to the numerous, complex, and poorly understood causes of preterm birth. As a nurse, I know too well the physical cost of prematurity on both mother and child, the emotional costs it takes on parents, and the fiscal cost that prematurity plays in our healthcare system. Reauthorization of the Preemie Act is necessary to continue the progress we have made to date and to do better by improving the health of mothers and babies. Now, Title II of Senate Bill 252, as amended, calls for the establishment of a national pediatric research network at the National Institutes of Health. This title builds upon the strong body of pediatric research the agency currently supports and strengthens it to improve secure research and clinical trials on pediatric diseases, to train pediatric researchers, and to disseminate research findings quickly so that all children may benefit. By developing a nationwide network of pediatric researchers, renewed efforts can be focused to develop treatments and cures for pediatric diseases and conditions, especially those that are rare. Children have unique health care experiences, treatment needs, and research challenges. And while public and private research has come a long way on pediatric diseases over the years, we know that we are still far behind on important diagnostic cures and treatments for far too many ailing children, and that's why this title is so important. Many of my colleagues know that this legislation is particularly important for one family in my congressional district, the Strongs. Victoria and Bill Strong are focused every day on getting the best care and treatments for their young daughter, Gwendolyn, who has spinal muscular atrophy, the same condition that my colleague, Mr. Upton, just referred to in his district. Her diagnosis has fundamentally changed the daily lives of their family, her school, and our Santa Barbara community. The low prevalence of these diseases makes them particularly hard to research. But for those affected, like Gwendolyn and others, a new cure or treatment could mean a world of difference. This title is common sense for Gwendolyn and all the other kids out there facing a rare medical disorder and their families. As Title II of this legislation, the title National Pediatric Research Network Act is an important step forward to helping these families and those who may develop these diseases long into the future. And I noticed that over the weekend there was a marathon that Gwendolyn and her father participated in my community to raise money just for the same purpose as this research would do. So it's both from the public and the private side that there's a concerted effort toward this end. And this network is based upon H.R. 225, bipartisan legislation I authored with my colleague, Representative Kathy Morris Roger, passed in the House as a standalone bill on suspension earlier this year with strong bipartisan support, and I'm so pleased to see it included in this package today. Title III of the legislation ensures the National Institutes of Health can continue to care for chimpanzees that have been retired from research. In 2000, Congress passed the Chimpanzee Health Improvement, Maintenance, and Protection, or CHIMP Act. The CHIMP Act established a sanctuary system for the lifetime care of chimpanzees no longer used in research, limited NIH spending on care for these chimpanzees, and required matching funds from nonprofit entities contracted by NIH to operate the sanctuary system. Today, NIH owns or supports hundreds of chimpanzees. Following a report from the Institute of Medicine, NIH has concluded the vast majority of its chimpanzees should be permanently retired from research. And this title makes it possible for the NIH to continue caring for the more than 100 chimpanzees currently in sanctuary and transition other chimpanzees to sanctuary over time by authorizing appropriate amounts of spending for fiscal years 2014 through 2018 out of the totals made available to the agency. It's a common sense and humane measure to fulfill the mission of the institutes and responsibly tend to the chimps in our care. I want to commend Chairman Upton, Chairman Pitts, Ranking Member Waxman, and Ranking Member Pallone for their leadership in bringing this bipartisan package of public health legislation to the floor. The staff on both sides of the aisle who have worked so hard on this legislation, and the Senate Help Committee leadership, Senators Harkin and Alexander, for their efforts on these measures. Moreover, Energy and Commerce members Congressman Eshoo, Congressman Lance, Congresswoman DeGette, and Congresswoman Morris Rogers are also to be commended for their work on the Preemie Act and the National Pediatric Research Network titles. These are critical bills, all of which deserve strong bipartisan support, and I urge my colleagues to join me in supporting S-252 as amended, and I reserve the balance of my time.
The gentlewoman from California reserves. The gentleman from Michigan is recognized.
Thank you, Mr. Speaker. At this point, I would yield 2 minutes to the gentleman from Pennsylvania, the chairman of the Health Subcommittee, Mr. Pitts.
The gentleman from Pennsylvania is recognized for 2 minutes.
Thank you, Mr. Chairman. I rise in support of another bipartisan bill, S-252, the Prematurity Research, Expansion, and Education for Mothers Who Deliver Infants Early Reauthorization, or the Preemie Reauthorization Act, would take important steps to protect and improve children's health, particularly the health of the nearly 500,000 children born prematurely in the United States every year. Since its passage in 2006, the Preemie Act has sponsored important research that has led to improved prevention and care of children born too early. This bill reauthorizes research and activities at the CDC related to the causes of preterm birth, improving data collection, and preventing preterm births. It also creates an advisory committee on infant mortality to coordinate federal, state, local, and private programs that address preterm birth and infant mortality. With 1 in every 8 infants born in the United States prematurely, this is a pressing issue. S-252 also authorizes the creation of the National Pediatric Research Network, a proven way to support pediatric research by coordinating multi-centered research activities, including those in rural areas. I would urge all of my colleagues to support this bipartisan bill, and I would like to commend Congressman Lance and Congresswoman Capps, Congresswoman Morris Rogers, Chairman Upton, and Ranking Members Waxman and Pallone for their leadership in this bipartisan effort. Thank you, and I yield back the balance of my time.
The gentleman from Pennsylvania yields back. The gentleman from Michigan reserves. The gentlewoman from California.
I continue to reserve.
The gentlewoman continues to reserve. The gentleman from Michigan.
Mr. Speaker, at this point, I would yield 2 minutes to a leading advocate of this legislation, Ms. Kathy McMorris Rogers, the chairman of the Republican Conference.
Thank you, Chairman. Thank you, Mr. Speaker.
The gentleman from Washington is recognized for 2 minutes.
I rise in strong support of the Preemie Reauthorization Act. Every 3 minutes, somewhere in the world, a child is diagnosed with cancer. In the United States, approximately 150,000 children have diabetes. I believe that medical research is the best investment we can make to change these statistics and find new cures for these diseases. Working with my colleague from California, Representative Lois Capps, we introduced the National Pediatric Research Network Act, which is included in the Preemie Reauthorization Act. In supporting this legislation, the Coalition for Pediatric Medical Research, which includes Children's Hospital in Seattle, from my home state, said that this legislation is critical to strengthen our nation's pediatric research enterprise. In addition, the Pediatric Research Network Act will authorize the establishment of a well-proven and evidence-based approach for addressing pediatric research. It will enable the National Institute of Health to support multi-institute research, to coordinate and streamline this important research. Most importantly, it will help to speed cures to the youngest patients. I urge support. Thank you, everyone, for your leadership, and I yield back.
Gentleman yields back. The gentleman from Michigan Reserve. Gentlewoman from California, continue to reserve.
I reserve.
Gentleman from
Mr.
Michigan.
Speaker, I would yield 2 minutes to another author of this legislation, someone who helped carry it across its bipartisan path, Mr. Lance from New Jersey.
Gentleman from New Jersey is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise in strong support of S-252, the Preemie Reauthorization Act, which will provide vital and continued medical educational research in the national effort to reduce preterm births. This legislation will advance the great progress made since the 2006 Act and support federal research and community involvement in premature birth research. Our nation's premature birth rate is among the highest in the world, and it is the leading cause of newborn death in the United States. Infants born just a few weeks too soon can face serious health challenges and are at risk for lifelong health and learning disabilities. In addition to its human toll among infants and its toll on their families, premature birth costs our nation's economy much financially. And while the medical community has made great strides in identifying the risk factors associated with premature births, far too many premature births today have no known causes. It is fitting that the House will consider this legislation this evening. November marks Prematurity Awareness Month, a product of the fine work of the March of Dimes. And the March of Dimes estimates that since 2006, 176,000 fewer births have been babies have been born too soon because of improvements in the preterm birth rate. This is why the members of the House and the Senate have worked in a bipartisan and a bicameral fashion to reauthorize the 2006 Act. I thank Chairman Upton and Chairman Pitts and Ranking Member Waxman and Ranking Member Pallone for their leadership on this issue, as well as Senator Alexander and Senator Harkin and Senator Bennett. I especially thank my colleague, Congresswoman Anna Eshoo of California, for working on this important issue.
The gentleman is recognized for an additional 1 minute.
Thank you very much. I especially want to thank Congresswoman Anna Eshoo of California for working on this important issue that benefits the health and well-being of the American people. This is how Congress should work together on issues that make a lasting difference for the American people. It is in that bipartisan spirit that I ask all of my colleagues to join with us in support of the Preemie Reauthorization Act so that we as a nation will be able to continue our focus on premature birth research and prevention. My thanks also to Congresswoman Capps for her leadership as well on this issue. Thank you, Mr. Speaker, and thank you, Chairman Upton.
Gentleman from New Jersey. Gentleman from Michigan.
Mr. Speaker, I'm going to just close. I have no other speakers, so if the gentlelady... Oh, wait, I'm sorry. I have one more speaker.
Okay, gentleman from Michigan.
I'm sorry.
Then...
And do you have another speaker?
Gentleman from California, you continue to reserve? Or
I'll
would you
continue to reserve.
Continue to reserve. Gentleman from Michigan.
I'll yield 2 minutes to the gentleman from Texas, Vice Chair of the Health and Oversight Subcommittee, Dr. Burgess.
The gentleman from Texas is recognized for 2 minutes.
I thank the chairman for yielding. The bill, the HOPE Act, is a common sense policy, and it's going to remove. Yeah, gentlemen.
Next.
I'll reserve.
You reserve back.
Gentleman from Michigan now reserves. Gentlewoman from California.
I'm just going to give the close and let
all
you
right,
go.
Then I would do the same. And, Mr. Speaker, I ask unanimous consent to submit letters of support from the following organizations into the record: the Children's Hospital Association, the Coalition for Pediatric Medical Research, Fight SMA, the Humane Society of the United States, the March of Dimes, and a joint letter from several health professional and public health organizations. So, Mr. Speaker, thank you. Mr. Speaker, I urge my colleagues to support this important package of public health legislation, and I yield back the balance of my time.
Gentlewoman yields back. The gentleman from Michigan.
Mr. Speaker, I would just say that every one of us has beautiful children like this in our districts. This bill is going to save lives. It has been bipartisan from the get-go, and again, I want to commend Republicans and Democrats in our committee, but certainly on the House floor when we passed this bill a number of months ago as well. And I just want to say, too, I was a speaker and a participant in an event just last week for Faster Cures, a networking group from around the country. Dr. Francis Collins was there, the head of the NIH. I spoke to Dr. Collins just in the last hour or so. He's delighted that this legislation is reaching the House floor tonight and hopefully will pass. And I know that we are going to continue to make a real difference in the lives of families, and that's what this is all about, and I would urge all my colleagues to vote yes. And I yield back the balance of my time.
The gentleman from Michigan yields back. The question is, will the House suspend the rules and pass Senate 252 as amended? Those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended and the bill is passed. And without objection, the motion to reconsider is laid upon the table. Without objection, the title is amended.